1. What is the primary pathophysiological characteristic of leukemia? A. Abnormal proliferation of white blood cells. B. Bone marrow suppression due to fibrosis. C. Chronic inflammation of lymph nodes. D. Deficiency of clotting factors. Answer: A. Abnormal proliferation of white blood cells. Rationale: leukemia is characterized by the uncontrolled proliferation of immature or abnormal white blood cells, which overcrowd the bone marrow and interfere with normal hematopoiesis. The other options describe conditions unrelated to leukemia. 2. Which type of leukemia is most common in children? A. Acute myeloid leukemia, AML. B. Burkitt lymphoma. C. Chronic lymphocytic leukemia, CLL. D. Acute lymphoblastic leukemia, ALL. Answer: D. Acute lymphoblastic leukemia, ALL. Rationale: ALL is the most common type of leukemia in children, accounting for about 80% of cases. AML is more common in adults, while CLL typically affects older individuals. Burkitt lymphoma is a type of non-Hodgkin's lymphoma. 3. What is a common early symptom of leukemia? A. Anemia and fatigue. B. Bruising easily. C. Chronic hypertension. D. Decreased urine output. Answer: A. Anemia and fatigue. Rationale: anemia and fatigue occur due to decreased red blood cell production as leukemic cells crowd the bone marrow. Bruising, B, is also a symptom but occurs later. Hypertension, C, and decreased urine output, D, are not typical early signs. 4. What is the primary diagnostic test for confirming leukemia? A. An MRI scan. B. Bone marrow biopsy. C. Complete blood count, CBC, with differential. D. D-dimer test. Answer: B. Bone marrow biopsy. Rationale: a bone marrow biopsy is the definitive test for leukemia, confirming abnormal white blood cell proliferation. A CBC, C, provides initial clues but is not confirmatory. MRI, A, and D-dimer, D, are not used for leukemia diagnosis. 5. Which leukemia is associated with the Philadelphia chromosome? A. Acute lymphoblastic leukemia, ALL. B. Burkitt lymphoma. C. Chronic myeloid leukemia, CML. D. Diffuse large B-cell lymphoma. Answer: C. Chronic myeloid leukemia, CML. Rationale: the Philadelphia chromosome, T922, is a genetic abnormality most commonly associated with CML, leading to abnormal tyrosine kinase activity. While it can appear in all, it is not seen in Burkitt lymphoma or diffuse large B-cell lymphoma. 6. Which of the following risk factors is most strongly associated with the development of leukemia? A. Alcohol consumption. B. Benzene exposure. C. Caffeine intake. D. Diet high in fat. Answer: B. Benzene exposure. Rationale: benzene is a known carcinogen associated with leukemia, particularly AML. Alcohol, caffeine, and dietary fat are not directly linked to leukemia risk. 7. Which type of leukemia progresses the slowest? A. Acute myeloid leukemia, AML. B. Acute lymphoblastic leukemia, ALL. C. Chronic myeloid leukemia, CML. D. Chronic lymphocytic leukemia, CLL. Answer: D. Chronic lymphocytic leukemia, CLL. Rationale: CLL is a slow-progressing leukemia that primarily affects older adults. AML and ALL are acute forms that progress rapidly, while CML has a chronic phase but can accelerate over time. 8. What is a common complication of leukemia due to bone marrow suppression? A. Anemia. B. Bronchitis. C. Cataracts. D. Diabetes. Answer: A. Anemia. Rationale: bone marrow suppression leads to decreased red blood cell production, resulting in anemia. Bronchitis, cataracts, and diabetes are not direct complications of leukemia. 9. Which of the following is a hallmark symptom of leukemia? A. Blurred vision. B. Persistent fatigue. C. Sudden weight gain. D. Tingling in extremities. Answer: B. Persistent fatigue. Rationale: fatigue is common in leukemia due to anemia and increased metabolic demands of leukemic cells. Blurred vision, weight gain, and tingling are not hallmark symptoms. 10. A patient undergoing chemotherapy for leukemia is at increased risk for which of the following? A. Aplastic anemia. B. Bacterial infections. C. Chronic hypertension. D. Diarrhea. Answer: B. Bacterial infections. Rationale: chemotherapy suppresses white blood cell production, increasing the risk of infections. Aplastic anemia is rare. Hypertension is not directly linked, and diarrhea is a side effect but not the primary risk. 11. Which chromosomal abnormality is associated with chronic myeloid leukemia, CML? A. 15q deletion. B. 9.22 translocation. C. 5q syndrome. D. 13p deletion. Answer: B. 9.22 translocation. Rationale: the Philadelphia chromosome results from a translocation between chromosomes 9 and 22, which is characteristic of CML. Other chromosomal abnormalities are linked to different conditions. 12. Which lab finding is expected in a patient with leukemia? A. Decreased white blood cell count. B. Elevated blast cells. C. Increased hemoglobin levels. D. Normal platelet count. Answer: B. Elevated blast cells. Rationale: leukemia is characterized by an increase in immature white blood cells, blasts. WBC count may be high or low, and hemoglobin and platelet levels are typically reduced. 13. What is the purpose of a bone marrow biopsy in leukemia diagnosis? A. Assess kidney function. B. Confirm blast cell percentage. C. Determine heart function. D. Measure blood glucose levels. Answer: B is confirm blast cell percentage. Rationale: a bone marrow biopsy determines the percentage of blast cells, which confirms leukemia. The other options are unrelated. 14. Which targeted therapy is commonly used to treat chronic myeloid leukemia, CML? A. Acyclovir. B. Imatinib. C. Methotrexate. D. Vincristine. Answer: B. Imatinib. Rationale: imatinib is a tyrosine kinase inhibitor that specifically targets the BCR-ABL fusion protein in CML. Other drugs are used for different cancers. 15. A patient with leukemia develops severe thrombocytopenia. What is the primary concern? A. Abnormal bruising and bleeding. B. Bone pain. C. Frequent urination. D. Hair loss. Answer: A. Abnormal bruising and bleeding. Rationale: thrombocytopenia, low platelets, leads to increased bleeding risk. Bone pain is due to marrow expansion, urination is unrelated, and hair loss is a chemotherapy side effect. 16. Which symptom is most concerning in a patient with leukemia? A. Frequent headaches. B. New onset fever. C. Slight muscle pain. D. Mild nausea. Answer: B. New onset fever. Rationale: fever can indicate an infection due to immunosuppression in leukemia patients. Headaches, muscle pain, and nausea are common but less urgent. 17. Which blood test abnormality is most commonly seen in leukemia? A. Hypercalcemia. B. Hypoglycemia. C. Increased blast cells. D. Low uric acid levels. Answer: C. Increased blast cells. Rationale: leukemia is characterized by an excessive number of immature white blood cells, blasts. Hypercalcemia and uric acid levels may be affected in other conditions. 18. Which therapy is most commonly used to induce remission in acute leukemia? A. Bone marrow transplant. B. Chemotherapy. C. Radiation therapy. D. Targeted immunotherapy. Answer: B. Chemotherapy. Rationale: chemotherapy is the primary treatment to destroy leukemia cells and induce remission. Bone marrow transplant is used in refractory cases. 19. A leukemia patient with neutropenia should avoid which activity? A. Attending crowded places. B. Drinking bottled water. C. Eating home-cooked meals. D. Walking outdoors. Answer: A. Attending crowded places. Rationale: neutropenic patients have a high risk of infection and should avoid large crowds. The other activities are generally safe. 20. What is a major concern with tumor lysis syndrome in leukemia? A. Electrolyte imbalances. B. Excessive blood clotting. C. High blood sugar. D. Low oxygen levels. Answer: A. Electrolyte imbalances. Rationale: tumor lysis syndrome leads to the release of intracellular contents, causing hyperkalemia, hyperuricemia, and hyperphosphatemia, which can lead to renal failure. 21. Which type of leukemia is most common in children? A. Acute lymphoblastic leukemia, ALL. B. Acute myeloid leukemia, AML. C. Chronic myeloid leukemia, CML. D. Chronic lymphocytic leukemia, CLL. Answer: A. Acute lymphoblastic leukemia, ALL. Rationale: ALL is the most common type of leukemia in children. AML is more common in adults, while CML and CLL are typically seen in older adults. 22. What is a key feature of chronic myeloid leukemia, CML? A. BCR-ABL fusion gene. B. Low platelet count. C. Normal white blood cell count. D. Slow lymphocyte maturation. Answer: A. BCR-ABL fusion gene. Rationale: CML is characterized by the BCR-ABL fusion gene, which results from the Philadelphia chromosome 9/22 translocation. 23. Which symptom suggests an early sign of leukemia? A. Chronic joint pain. B. Frequent infections. C. High blood pressure. D. Sudden weight gain. Answer: B. Frequent infections. Rationale: leukemia leads to abnormal white blood cells, increasing the risk of infections. Joint pain can occur later, but weight gain and hypertension are not early signs. 24. A patient with acute leukemia reports gum bleeding. What is the likely cause? A. High white blood cell count. B. Increased platelet production. C. Low platelet count. D. Vitamin C deficiency. Answer: C. Low platelet count. Rationale: thrombocytopenia, low platelets, leads to increased bleeding risk, including gum bleeding. Vitamin C deficiency causes scurvy, but is not a primary concern in leukemia. 25. What is a primary goal of leukemia treatment? A. Control blood sugar levels. B. Decrease platelet function. C. Induce remission. D. Lower blood pressure. Answer: C. Induce remission. Rationale: the goal of leukemia treatment, particularly chemotherapy, is to eliminate cancerous cells and achieve remission. The other options are not primary treatment goals. 26. Why do leukemia patients often develop anemia? A. Decreased white blood cell production. B. Excessive bleeding. C. Increased bone marrow activity. D. Suppression of red blood cell production. Answer: D. Suppression of red blood cell production. Rationale: leukemia disrupts normal bone marrow function, leading to decreased RBC production and anemia. 27. Which leukemia subtype is associated with the worst prognosis? A. Acute promyelocytic leukemia, APL. B. Chronic lymphocytic leukemia, CLL. C. Acute lymphoblastic leukemia, ALL, in adults. D. Chronic myeloid leukemia, CML. Answer: C. Acute lymphoblastic leukemia, ALL, in adults. Rationale: ALL in adults has a worse prognosis than in children, despite treatment advances. 28. Which of the following is a priority nursing intervention for a leukemia patient undergoing chemotherapy? A. Administering iron supplements. B. Monitoring for signs of infection. C. Encouraging weight gain. D. Restricting fluid intake. Answer: B. Monitoring for signs of infection. Rationale: chemotherapy suppresses the immune system, increasing the risk of infection, making monitoring a priority. 29. Which of the following findings is most concerning in a leukemia patient? A. Enlarged spleen. B. Petechiae and bruising. C. Mild fatigue. D. Slight weight loss. Answer: B. Petechiae and bruising. Rationale: these indicate thrombocytopenia and an increased bleeding risk, which can be life-threatening. 30. Which test is used to differentiate between different types of leukemia? A. Bone marrow biopsy. B. Chest X-ray. C. Electrocardiogram, ECG. D. Liver function tests. Answer: A. Bone marrow biopsy. Rationale: a bone marrow biopsy provides definitive diagnosis and classification of leukemia subtypes. 31. Which patient is at the highest risk for developing leukemia? A. A child with Down syndrome. B. A young adult with diabetes. C. A pregnant woman. D. A person with high blood pressure. Answer: A. A child with Down syndrome. Rationale: Down syndrome is associated with an increased risk of leukemia, particularly all. 32. What is the function of a lumbar puncture in leukemia? A. Assess for central nervous system involvement. B. Determine kidney function. C. Measure heart function. D. Test liver enzymes. Answer: A. Assess for central nervous system involvement. Rationale: A lumbar puncture detects leukemic infiltration in the CNS, which is common in all. 33. What is an early indicator of tumor lysis syndrome in leukemia patients? A. Decreased potassium levels. B. Elevated uric acid levels. C. Increased platelet count. D. Low calcium levels. Answer: B. Elevated uric acid levels. Rationale: Tumor lysis syndrome results in hyperuricemia due to rapid cell breakdown. 34. What is the purpose of an allogeneic bone marrow transplant in leukemia? A. Create new blood cells. B. Destroy cancer cells directly. C. Provide immune suppression. D. Reduce fluid retention. Answer: A. Create new blood cells. Rationale: An allogeneic transplant replaces diseased marrow with healthy donor cells to produce normal blood cells. 35. A leukemia patient receiving chemotherapy reports mouth sores. What is the best nursing intervention? A. Encourage frequent brushing with a hard-bristled toothbrush. B. Provide saline mouth rinses. C. Restrict fluid intake. D. Administer broad-spectrum antibiotics. Answer: B. Provides saline mouth rinses. Rationale: Saline rinses help with oral mucositis, a common chemotherapy side effect. Hard-bristled toothbrushes can worsen sores. 36. Which leukemia patient is most at risk for spontaneous bleeding? A. A patient with leukopenia. B. A patient with thrombocytopenia. C. A patient with neutropenia. D. A patient with lymphocytosis. Answer: B. A patient with thrombocytopenia. Rationale: Thrombocytopenia, low platelets, leads to an increased bleeding risk. 37. Which of the following is a major complication of leukemia treatment? A. Bone marrow suppression. B. Increased muscle mass. C. Improved immune function. D. Weight gain. Answer: A. Bone marrow suppression. Rationale: Chemotherapy and radiation suppress the bone marrow, leading to pancytopenia, low WBCs, RBCs, and platelets. 38. What dietary recommendation is appropriate for a neutropenic leukemia patient? A. Avoid raw fruits and vegetables. B. Increase dairy intake. C. Eat undercooked meats. D. Consume high-fiber foods. Answer: A. Avoid raw fruits and vegetables. Rationale: Raw foods may contain bacteria, increasing infection risk in immunocompromised patients. 39. A leukemia patient with neutropenia has a fever of 38.5 degrees Celsius, 101.3 degrees Fahrenheit. What is the priority action? A. Administer antipyretics. B. Obtain blood cultures. C. Offer fluids. D. Encourage rest. Answer: B. Obtain blood cultures. Rationale: Fever and neutropenia may indicate a life-threatening infection. Cultures help identify the cause. 40. Which patient statement suggests understanding of chemotherapy side effects? A. I should avoid crowded places. B. I can stop my medications if I feel better. C. My immune system is stronger now. D. I don't need to worry about infections. Answer: A. I should avoid crowded places. Rationale: Patients undergoing chemotherapy are immunocompromised and should avoid infection risks. 41. Which white blood cell type is most commonly affected in acute lymphoblastic leukemia? All. A. Lymphocytes. B. Monocytes. C. Eosinophils. D. Basophils. Answer: A. Lymphocytes. Rationale: All primarily affects immature lymphocytes, disrupting normal immune function. 42. What is a common side effect of chemotherapy in leukemia patients? A. Hypertension. B. Myelosuppression. C. Increased appetite. D. Increased white blood cell count. Answer: B. Myelosuppression. Rationale: chemotherapy suppresses bone marrow function, leading to anemia, neutropenia, and thrombocytopenia. 43. Which finding suggests that a leukemia patient is at risk for an infection? A. Neutropenia. B. Thrombocytosis. C. Polycythemia. D. Leukocytosis. Answer: A. Neutropenia. Rationale: neutropenia, low neutrophil count, increases the risk of infections due to impaired immune response. 44. What is a major risk factor for developing secondary leukemia? A. Previous chemotherapy or radiation therapy. B. High vitamin C intake. C. Regular aerobic exercise. D. Low sodium diet. Answer: A. Previous chemotherapy or radiation therapy. Rationale: exposure to cytotoxic agents increases the risk of developing secondary leukemia. 45. What is the main role of tyrosine kinase inhibitors, TKIs, in leukemia treatment? A. Block BCR-ABL protein activity. B. Increase red blood cell production. C. Suppress platelet aggregation. D. Enhance neutrophil function. Answer: A. Block BCR-ABL protein activity. Rationale: TKIs, such as imatinib, inhibit the BCR-ABL protein, a key driver of CML. 46. A leukemia patient undergoing chemotherapy reports nausea and vomiting. What is the best nursing intervention? A. Administer antiemetics before chemotherapy. B. Encourage large meals. C. Increase fluid restriction. D. Provide spicy foods. Answer: A. Administer antiemetics before chemotherapy. Rationale: prophylactic antiemetics prevent nausea and improve patient comfort. 47. Which leukemia type is characterized by the presence of Auer rods in blast cells? A. Acute myeloid leukemia, AML. B. Chronic myeloid leukemia, CML. C. Acute lymphoblastic leukemia, ALL. D. Chronic lymphocytic leukemia, CLL. Answer: A. Acute myeloid leukemia, AML. Rationale: Auer rods are needle-like inclusions seen in AML blasts. 48. What is the primary purpose of prophylactic cranial irradiation in leukemia patients? A. Prevent central nervous system, CNS, relapse. B. Reduce bone pain. C. Improve chemotherapy efficacy. D. Lower white blood cell count. Answer: A. Prevent central nervous system, CNS, relapse. Rationale: leukemia cells can infiltrate the CNS, making prophylactic radiation necessary in some cases. 49. Which of the following symptoms is most concerning in a leukemia patient? A. Fever and neutropenia. B. Mild headache. C. Occasional bruising. D. Fatigue after exercise. Answer: A. Fever and neutropenia. Rationale: neutropenic fever is a medical emergency requiring immediate intervention. 50. Which laboratory finding is common in leukemia patients? A. Pancytopenia. B. Elevated albumin. C. Low bilirubin. D. High sodium levels. Answer: A. Pancytopenia. Rationale: pancytopenia, low RBCs, WBCs, and platelets, occurs due to bone marrow suppression.